Medically, the mutated bacteria which acquired resistance to antibiotics are called drug-resistant bacteria. If patients are infected of drug-resistant bacteria, it will not only make cursing process a lot more difficult, place extra burden on inpatient care, and also put the caregivers into the danger of becoming drug-resistant bacteria carriers. For the sake of everyone's health, let's work together against the spread of drug-resistant bacteria. How to prevent the spread of drug-resistant bacteria? Drug-resistant bacteria are spread mainly by contaminated hands, clothes, medical equipment, and environment. To avoid becoming a carrier of bacteria, please follow the below do's and don'ts of contact isolation at work. 1. Recognize the contact isolation sign. First of all, medical personnel will put a contact isolation sign on the door of patient's room and relevant equipment on the headboard of patient's bed. 2. Follow 5 moments for hand hygiene. When you are at work, before touching a patient, before cleaning, aseptic procedure, after body fluid exposure risk, after touching a patient, after touching patient's surroundings, please wash your hands thoroughly or use alcohol-based hand rubs to rub your both hands for 10 to 15 seconds. Without thoroughly washing your hands, do not use your hands to touch the mucosa around your mouth, the nose, or the eyes. Wear the protective clothes when contact with patients. Nursing stations will provide clean visitor's gown each day. Wear it and put on your gloves when you touch patient's skin, clothes, or beds. Please wear a mask when you or your patients are having symptoms such as fever, cough, or sneeze. During work, if you need to make the bed or soil clothes for patients, please avoid shaking sheets and clothes in the air. Visitor gowns should be stored when not in use. Every day, after putting on new visitor's gown, please throw the old ones into the laundry basket. Take off the gloves, visitor gown, and mask before exiting patients' rooms. Take off the gloves, visitor gown, and mask before exiting patients' rooms. Remember not to open doors, nor use public facilities such as drinking fountains with gloved hands. Do not contact with other patients or caregivers. During work, do not contact with other patients or other caregivers. Unless with medical needs, patients and caregivers should minimize the frequency of activities outside the wards. Caregivers should also avoid taking patients or wearing visitor gowns in public areas. Healthcare concepts. Taking care of your own health is an important matter when working in hospitals. Now, let's take a look at the basic healthcare concepts. Wash your hands frequently. 5 moments for hand hygiene. 1. Before touching a patient. 2. Before cleaning aseptic procedure. 3. After body fluid exposure risk. 4. After touching a patient. 5. After touching patient's surroundings. Besides, if there are no soaps and water to wash hands, alcohol-based hand rubs work fine as well. Cough etiquettes. When coughing, please remember to 1. Cover the mouth, nose with a tissue and promptly dispose it after use. 2. Put on surgical masks when having symptoms of coughing. 3. Use alcohol-based hand rubs or soaps and water to clean hands after contact with respiratory secretions. 4. Keep at least 3 feet distance with other people. Coping approaches on fever and acute respiratory symptoms. Put on masks immediately when having fever or acute respiratory symptoms. Go home to take a rest immediately and stop taking care of patients. Changing and putting on clean clothes every day. Keep everything clean is the best method for health care. Put on clean clothes every day to avoid contracting bacteria. Prevent the spread of bacteria. Educate yourself on healthcare concepts. Take care of others and protect yourselves.